Hey everyone, Howard Gearhauser here again alongside my dad, Dr. Richard Gearhauser. In today's video, we have a really important topic, and that is depression and bipolar disorder. And more specifically, are there any safe alternatives outside of the pharmaceutical medications to help with depression and bipolar? As many of you might know, the pharmaceutical medications for these particular health conditions have a lot of side effects. And I know we want to avoid that if we can. So we want to cover some different things that you can do to safely address some of the, this health condition and some of the symptoms that go along with it. So Dad, can you take it away?
Yeah, this is an important topic. Depression is a significant segment of the population, people suffering from depression. Mainstream medicine, psychiatry typically uses drugs. If you look at the standard of care of a psychiatrist or a primary care physician, the standard of care is drugs for depression and bipolar. And I think a legitimate question has been asked, should this be the standard of care? Should there be other things that maybe are safer and just as effective that should be the standard of care instead of drugs being the number one thing to go to? Maybe they should be the fallback. But the way this system is now, the psychiatrists tend to use drugs first and then maybe fall back onto something that is less toxic. So that's kind of the state of the art right now in the United States. And so here we can discuss, how effective are these drugs, and we can discuss the side effects, and we can discuss what are some alternatives that are out there in the literature that are being used, but unfortunately, again, they're not the standard of care and they're not universally used.
So let's talk about, as you just mentioned, when let's say we are suffering from depression, what's kind of the sequence of events that happens? We're struggling, we go in and we see a psychiatrist. From their perspective, what's their objective? Is it just to put you on drugs, or are there other things that they're trying first?
Well, I mean, I guess it depends on the psychiatrist. It seems like, drugs are the main thing in their armamentarium. And I know that because I've practiced medicine for over 37 years. And I see that when a patient sees a psychiatrist, they almost always, with depression or with bipolar, they almost always come back with a prescription for a drug. So the drugs are definitely the mainstay. Now, primary care doctors use these drugs a lot as well. So it's not just psychiatrists. I think a primary care doctor is much more likely to maybe consider, some lifestyle changes or something before starting the drugs. But typically, the drugs, as I say, are the standard of care. And if a physician or a psychiatrist doesn't use those, they can actually get in hot water with their medical societies because the standard of care for a physician is like a law that you need to follow these laws. You follow the algorithm. That's what mainstream medicine's all about, is follow the algorithm. And the algorithms should be focused on evidence and mechanisms that make logical sense, mechanisms that kind of correlate with the scientific data that we have. But I think the problem is the drugs really are the mainstay because of the lobbying that's done by the pharmaceutical companies. So the pharmaceutical companies, they have had their way with American medicine. And so hopefully, and that's one of the reasons I do this, is I'm trying to change this a little bit.
So in terms of some of the side effects, obviously these drugs are impacting the very complicated system and the complicated wiring that we have within our body. And as we've talked about in other videos, there's normally a feedback loop. When you stop an important function within the body, there's a feedback loop that can have a bunch of side effects, as we've seen. What specifically is being impacted by these drugs, and what's the feedback loop that we're seeing in terms of side effects?
Is well, these feedback loops are very complicated, and there's things in these feedback loops that are unknown. But what seems to happen and makes logical sense with the way nature works and the way our biochemistry works with the feedback loops is that if we take something, so one of the most common antidepressants are the SSRIs, and so these are the serotonin reuptake inhibitors. And what they're thought to do is increase levels of serotonin, which have a positive impact on mood. But when you do that and you have high serotonin levels, the body starts to make adjustments. And because of this adjustment, that's one of the reasons why people, and this is one of the big problems with the antidepressant drugs, like the serotonin reuptake inhibitors, is that it can be very difficult to get off of them because people are usually on these long term. So in long term, their feedback mechanisms, the body has this homeostatic place it wants to be, and you alter that with a drug. And over time, then your body has adapted to that. And so what we find is that many people can't get off of these drugs because they've made the adjustments. And then if you take them off the drug, everything's out of balance again. And so this is seen where people really struggle with getting off these drugs, and it can be extremely difficult. Now, the problem with being on the drugs is they have a lot of side effects. They can cause weight gain. They can cause sexual dysfunction. Sometimes that can be permanent. They affect blood clotting. They affect the risk of falls. You can gain weight. They go on and on. And then now, one of the things that's used more and more with depression that's maybe resistant to using the first line. So the first line treatments are usually the SSRIs or maybe the norepinephrine affecting drugs. Those are the first line treatment. And the second line treatment now has become the atypical antipsychotic medications. And this is particularly true, or these are used a lot more with bipolar disorder. So bipolar disorder, and these drugs have even more side effects. They can increase the risk for sudden death. They create a condition called torsades de Pointes, which is a problem with the heart rhythm that can cause ventricular fibrillation, which happens when you get a heart attack. Well, you can get that from these drugs. That's not common. There's another uncommon but very serious and very disconcerting side effect of these atypical antipsychotic medications that are used for depression now and used for bipolar is that they can cause tardive dyskinesia, which is where you make a funny motion, that is not good. Your tongue whips out, or you don't have control over that. So tardive dyskinesia is a bad problem. Metabolic syndrome, weight gain, these are all side effects that can come with these drugs. So these drugs are the standard of care. They're prescribed millions of times each year in the United States. And, the question, like I said, is, are these drugs proven to be effective? And I think that's a big question that's been out there.
So what would you say to someone who is on medication for depression or for bipolar? What are some things that they can start doing right now? Obviously, we're not telling them to just throw their medication in the toilet. What are some things that they can start doing that maybe would help them wean off the medication in the future?
Well, yeah, and we'll get to that. I want to get to some alternative treatments, but Before we get to that, I would say that these side effects aren't good, and the efficacy of the antidepressants has come into questions. And one of the reasons this came about is some scientists and practitioners, they looked at all the data from the antidepressant drug trials. So these get submitted to the FDA, and the FDA, rules, okay, they're effective, even though the effectiveness is sometimes very, very marginal compared to placebo. So these are randomized controlled trials where placebo is given and the drug, and they measure the difference, and you have to have a certain effect above placebo for it to be FDA approved. So these drugs obviously got FDA approved, but using the Freedom of Information Act, some physicians and scientists go, hey, we want to look at the data ourselves. It's like, we don't trust, the drug companies or the FDA. We want to see the data themselves. So these scientists looked at the data, and what they found is that when they looked at all these studies that were submitted to the FDA, not just the ones that led to the approval of the drug, that overall there was very little benefit from the antidepressant drugs compared to placebo. In other words, there was no difference. In other words, they worked about the same as placebo. And it was at the level where they would say maybe there was a tiny benefit above placebo, but it wouldn't be clinically noticeable. Like it's not, it's like maybe 5% or something, where you'd have to treat 40 people to get one person to have a benefit from that drug. So really, when you look at all the data looking at not only the trials that led to the approval of the drug, but also the trials that failed, look what you need to do. You need to look at all the trials. You can't just cherry pick trials and pick the best ones and then use those to get it approved. So what they found is they're really hardly better than placebo, which to me is shocking, that the FDA will approve drugs where they really don't have a clear benefit. And then on top of that, they have all the risks that I talked about. And then we're not even talking about cost. These new antidepressants, Prozac was one of the most marked up drugs in the history of mankind. It was marked up, I don't remember the exact numbers, but something like 20,000% above what it costs to manufacture it to what they charge for it. So the cost is another big thing. Society in general really has to pay for these costs through our health insurance and all these different things. So it's not just the individual. It's not like when you get prescribed Prozac that you take your wallet out and pay cash for it. You do it through your insurance, so it costs all of us. And the antipsychotic medications, these things were illegally promoted off-label to doctors, so that all that's out there, that they paid hefty fines for that. So these drugs make the pharmaceutical companies tons of money, but it's kind of a dishonest system where they hardly work. Now, if a psychiatrist or a doctor is going to prescribe a drug that has a bunch of potential side effects, which I don't think they even tell you that when they prescribe it. They just go, here, I think this will make you feel better. And that's part of the placebo effect, thinking you're going to get something that helps. And so that's why people feel it helps, is placebo really works. And so you add the placebo effect to your doctor prescribing something, it does really work, but it doesn't work any better than a sugar pill would work. And the sugar pill wouldn't have nearly as many side effects as these actual drugs that are messing with our brain chemistry.
Exactly, and that kind of shows the power of the mind too, and the power of belief. If you believe something's helping you and all of a sudden you start feeling better, there's something to that. And we do touch on that in other videos, but I want to get to some of these alternatives. That way you can walk away from this video with real things that you can implement in your life. So can we touch on some of those?
Yeah, so, and these aren't things that I'm recommending that you do. These are things that I would discuss with your psychiatrist, your physician, maybe download some of the research studies on this. So I'm not telling you how to treat your medical condition at all. And I'll give some ideas about maybe, getting to the root issue, like maybe how would you prevent this? That would be the best way. Don't get depressed in the beginning. So there's a physician, and there's a lot of physicians out there that are spearheading this movement of, hey, these drugs don't really work. They should not be the standard of care. They don't really work. They have a lot of side effects that are very expensive. So there's a lot of negatives to using these drugs. And there are alternatives that have been shown to work better or as well. Okay, so this Dr. Benedetti, who's in Milan, Italy, he has a clinic, and for over 15 years, since the 90s, he has been treating bipolar disorder and depression that is resistant to drugs. So he's a specialist, so he gets the people that don't respond to the drugs. And he has a 3-phase protocol that he uses to treat his depressed or bipolar patients, that in patients that don't respond to the typical antidepressant drug and then the antipsychotic drugs. He has 3 protocols that work greater than 50% in people that don't respond to drugs. That's an amazing result. Just 1 out of 2. And it's almost immediate. Whereas the drugs, if you take a drug that's going to treat your depression, usually it takes weeks, sometimes months before you feel effect. Well, this protocol, they feel the effect right away, like in 1 day. So here's something that works very well, and it's very safe in that it doesn't have the side effects of these antidepressant drugs. Okay, so what does this Benedetti do? Okay, one of the things which is kind of surprising and kind of one of those things that I don't recommend that you do necessarily, because there could be risks and it's pretty extreme. So I don't recommend that you do this, but I want you to know this so you can talk to your doctor about it. So what they do is they do sleep deprivation. Okay, so what do? Well, they make you stay up all night, so they don't let you go to sleep, and this almost immediately resets that depression. Now, I looked at this and I go, maybe that's why us doctors don't get depressed as often, is you can reset your depression by not sleeping for a whole night. So staying up 36 hours. When I was in my medical training and on call, you're typically up 36 hours. And that resets. Was it reset? Well, it resets your circadian rhythm. Okay? So circadian rhythm, which we talk about ad nauseum, because it's so important, it's the key to preventing depression, is to keep your circadian rhythm balanced. Okay, so the sleep deprivation is a big part of it. The other big part of it is bright light therapy. So what they do is they get these bright lights lamps. So it's a lamp that has 10,000 lux of light, which is about like daylight amount of light. And they shine that in their eyes for 30 minutes in the morning. So that's another circadian setter, is the bright light. Now they use these light boxes. I don't necessarily recommend that, because the blue light is what sets your circadian rhythm. Trouble is blue light damages your eyes when it's isolated from red. So if you're going to use a light box, I would say you need to have a red light with it, an infrared and red light, or use the sun. the sun would be the best way to go. But they use the light box. So sleep deprivation, light box. The other thing they use is lithium. So lithium's a mineral. Lithium's used for bipolar disorder, and it's quite effective. It's used for other psychotic disorders. The trouble with lithium is the dose they use is really high, and there's some nasty side effects with high dose lithium. But what they found is just the amount of lithium that's in your water can help depression. So you can microdose lithium on your own, and you use that. One of the supplements it uses lithium orotate. So you take the equivalent of 5 milligrams a day of lithium orotate, and that amount could be in your water. And they've done studies, there's a couple of studies in Japan show that Japanese people that had the higher amounts of lithium in their water compared to people that had the lower amounts of lithium in the water had significantly less suicide, significantly less. And that's been shown over and over that communities that have more lithium in their water have less suicide. So the third prong of the protocol for Dr. Benedetti is the lithium. And so this is more effective than the drugs, and it can be used when the drugs fail. The trouble with this protocol is, again, lithium has a lot of side effects when used at a high dose, and I'm not sure the dose that Benedetti uses, but I imagine it's the psychiatric dose, which is high, and there's a risk to your kidney and other things. So there's low dose lithium, which also has beneficial effects. There's microdose lithium, which is the amount found in water supplies. And then there's the kind of psychiatric dose, which is a little scary. But this shows you there's an alternative out there without the other negative side effects, very low cost, except when they do the sleep deprivation, these patients are hospitalized. So that, would add to the cost, because they, when you miss sleep for a night, they don't want you out there driving the next day or doing some other activity that could put you in harm's way because your reaction time is slowed. Although that doesn't always happen, but that can happen with sleep deprivation. So this isn't something I'm telling you to do because there are risks. But sleep deprivation is a powerful resetter of your circadian rhythm. There's evidence that lithium also resets your circadian rhythm. So we're kind of really piling on the circadian stuff, highly effective. But mainstream medicine, no. It's you use this drug, then you use this drug. If that drug doesn't work, then you use this drug. Here we're using drugs that work the same as placebo and acting like, we're doing evidence-based medicine, same as placebo.
Yeah, and I think the important takeaway, even if you don't try this alternative, is that there are alternatives out there. There's stuff available outside of mainstream medicine. So you should keep your eyes and your ears open and maybe consider trying some of these things. Again, make sure you do discuss this with your doctor before trying this specific recommendation, because as my dad mentioned, you want to do this in a controlled environment with an expert who knows what they're doing, because there are potential side effects from some of these different steps within this protocol. So be careful, make sure you check in with your doctor or psychiatrist. And then touching on the circadian rhythm, which we harp on in almost every single video, when you get your body and mind in sync with the day and night cycle of the earth, it makes sense that the chemical imbalance inside of your brain could be corrected just from that. So getting your circadian rhythm dialed in is pretty amazing. And when we talk about one of the important steps with circadian rhythm, which is watching the morning sunrise, talk about your natural antidepressant right there. It's almost impossible to feel depressed when you're viewing a beautiful sunrise coming up first thing in the morning. It's a great way to start off your day, so make sure you're incorporating that too. Is there anything else you wanted to add?
Well, as far as prevention, as Howard mentioned, the key is don't let your circadian rhythm get out of line. In our modern world, I think it's more common to have your circadian system messed up because we live indoors, we live under artificial light, we don't have darkness at night, and that leads to this epidemic of depression and bipolar. So the way to prevent it is pretty much common sense. You have to follow our protocols that are really just nature's protocols. They're not really our protocols, but humans in their history, they were outdoors most of the time. They saw the sunrise, they saw the sunset. The only light they saw at night for tens of thousands of years was fire and the moon and the stars, and that's it. So we need to re-embrace darkness at night. If you can embrace darkness, which is tough. I mean, family members, where you live, it might not be dark. You know, if you live in a big city, it might not be dark, but you can mitigate with the glasses that block the blue light. The blue light and part of the green light are the part that really disturb our circadian rhythm. So minding your light, both getting plenty of natural sunlight and mitigating artificial light is the best preventative for depression. Now, there's other things that help depression, like exercise and eating during the daylight. And these are all things that are more cues to your circadian rhythm. So that's one of the things we really focus on, is piling on the natural cues to our circadian rhythm, piling them on. You're much less likely to get depression or bipolar or any of the other diseases that we call the modern diseases, or the diseases of aging, like cancer and heart disease and autoimmune diseases and all these other diseases that are becoming more common. I was just reading today, it was all these movie stars that came out to discuss the disease they have. And, you know, there's cancer, autoimmune disease, depression, bipolar, you know, and the movie stars even have more things working against them as far as things that mess up. They're usually under bright fake lights, and a lot of times they're, especially musical performers, they're up late at night. And we see these people dropping like flies, you might say. If you know, and of course we hear about it more because they're famous, but it's just amazing to me how many, every week there's somebody else that's contracted some horrible thing that's probably tied into this aspect of their life.
The other thing that seems to be really common in the last couple of years too is the number of suicides from celebrities. And you hear about these celebrities who seemed fine one moment, and then the next moment, you know, they've hanged themselves, for example, and people are so unbelievably baffled and confused as to why they would do that. What are your thoughts on that? I mean, does that have to do with the medication and a side effect of the medication? How do people go from this, like, being pretty happy and, you know, on top of the world to, like, wanting to not be here anymore?
Well, there is some evidence that these drugs may heighten the risk of suicide, and this was especially true in children. So we don't know if it's the drugs that maybe heighten that risk, or just depression itself. I mean, if you're depressed, you know, it's a vicious cycle. You get more and more hopeless, and that hopeless feeling of like life isn't worth living, you know, so it could be just depression leading to these suicides. And the drugs, you know, may play a role in that. They may heighten that risk. And in kids, that certainly seems to be the case. And then also things like violence, there's been some tie-ins between the antidepressants and acts of violence. Like many of the mass murderers were either on one of these drugs, the antidepressants or the atypical antipsychotics, or they were coming off those drugs. And this is probably the majority of these. Unfortunately, this is suppressed. Like they never come out in the media or anywhere, come out and tell you, oh, this person was seen a psychiatrist and they were on this and this drug. I think it's because of the pressure of the pharmaceutical industry and how much money they spend in the media, that no, we're not letting this out, that most of these people are on these drugs when these things happen. But you can go to a website called SSRI Stories. So SSRI Stories documents thousands of cases of people killing people or doing crazy things, beating their girlfriend to death with a hammer, things that just sound like, who could do that? And these drugs are associated with these weird, violent acts that you would never think a rational person would do something like that. Now, I don't know. This is conjecture that the drugs lead to this, but I feel like this is real. And you look at that SSRI Stories, and it just goes, and these are documented things that were in the newspaper, and it's like you can't deny it that this is crazy. There, case after case after case, and then every time one of these mass murders happens, they've been seen as psychiatrists or he was on something, almost always.
And the other thing about depression too, I think oftentimes we don't allow ourselves to feel depressed or low energy. It's like we always need to be positive and excited. I think it's a natural thing to feel depressed sometimes, and that's just kind of the cycles of life. And learning to go into it and almost befriend the feeling instead of running from it, I think is important too. It's not always going to be perfect, your life. There's going to be moments of low energy where you just don't feel like you have it, and maybe you do feel a little bit depressed. But I think the more you incorporate nature and the more you can mitigate our man-made exposures, including prescription medication, the better off you'll probably be to just be living in a more natural state. And learning, again, to become friendly with the various emotions, I think is important too. The problem is, if you're not connected to nature, you might find yourself in one of these ruts where you just cannot get out of this depressed state. And then next thing you know, you're on the prescription medication. And as we've talked about, there's a lot of side effects that come from the medication, and it's not really even proven to be that effective in solving your depression. So I think it's, learning to be okay with being depressed every once in a while is part of it. Reconnecting with nature, mitigating the man-made exposures is really important for you to get back in sync, get your circadian rhythm dialed in. Anything you want to add to that, Dad?
Yeah, I just want to mention that, and looking at the research on the antidepressants, they do work better in severe depression. So I'm not telling anyone out there that has, severe depression, suicidal thoughts, that you should not go to a psychiatrist and you should not, do what the psychiatrist recommends. Because with the severe cases where your back is really against the wall, the drugs seem to work better. I'm still not a fan of them. That's just my own personal choice. But the evidence shows that when you're in that severe category, that there appears to be more benefit than if you're moderate or mild.
Right. Well, if your back's against the wall, like you're having those suicidal thoughts and you're just like, I do not want to be here anymore, then of course, anything that's going to keep you around is going to help you. But you still should try the natural things, because who knows? This might be something that, boom, just everything clicks and your brain's working properly. It's rebalanced again. So it's just something to think about. You should be incorporating these things no matter what. But especially if you feel depressed, it's a sign that this rhythm is off. You got to get that dialed back in. Yeah, I mean, we're not telling you to stop taking your medication. We're just telling you things that you could add to. Maybe eventually your doctor will wean you off it. So just some important things to consider. And we have other protocols too. Go check out our video, 10 cutting edge health protocols that your doctor will never tell you. That'll go into detail about some other things you can do to optimize your mind, body, and spirit. So this will help with depression, but this really helps with just getting everything dialed in. Anything you want to add before we sign off, Dad?
No, I think that's good. Circadian rhythm, I think it's a key root issue that's related to not only depression, but most of our diseases of our modern society.
Yes, exactly. Circadian rhythm, getting that dialed in. Now, if you're someone who would like to work with us in a coaching situation, we do have that program open right now. So there's enrollment available in our coaching program if you'd like to work with me and my dad and some of our other experts to get your health and your mind really dialed in. That's an offer. Take it or leave it. If not, just keep doing the free stuff. We have tons of free content on the YouTube channel. So make sure you check that out. And we will see you on the next episode. Thanks, Dad.
See ya.